So, Sean, I know that your presentation is going to be just as phenomenal. So I'll hand over to you, Sean. And Sean is a queer Mi'kmaq scholar from the Kaluku First Nation. Forgive me if I mispronounce anything. He is an assistant professor at the School of Health Policy and Management and special advisor to the Dean on Indigenous Resurgence in the Faculty of Health at York University here in Toronto. He is the chair of the Indigenous Council at York and is co-chair of the working group on anti-Black and anti-Indigenous racism in the Faculty of Health. Additionally, Sean is a board member of the AIDS Committee of Toronto. Sean, we know that you'll be great as well. Go ahead.
Okay, thank you. Thank you all. Good afternoon. I don't know how I come after those amazing presentations. So first I want to say thank you to Valerie, Jasmine, and Krista, and a special hello to Jasmine, who was really an instrumental part to the research that you're about to hear and really helped drive this PhD research forward, and is one of the reasons why I'm a doctor here today. And I haven't had a chance to connect substantially after that. So I'm very delighted to see you. I'm going to share my screen with this presentation. So today I'm presenting around wellness research with Indigenous peoples, and this was really a piece of work that came out of my PhD dissertation that was really focused around policy and understanding how does policy impact service delivery for Indigenous people living with HIV in the province of Ontario. That I will be quickly chatting about. Very text heavy, don't have lots of beautiful pictures like the last presentations that you saw, but I think some of this is important around the work that came out. And so in terms of some of the acknowledgements that I want to give in that research is dedicated to all Indigenous peoples who are living with HIV and are fighting for their recognition, equal rights within this land that is their own. And that I really hope that this work helps to continue that fight and to really advance some of what's come out of there. This research was done in partnership with the Ontario Aboriginal HIV/AIDS Strategy and Two-Spirited People of the First Nations, who were equal community partners on this. I recognize Dr. Lynn Lavallee, who is my supervisor, but to the many people across the province who really helped drive this forward. And then I want to pay special attention to Tony Nobis, who was the executive director of OHAS. And so he was the person that led me down this path of the research and was the most heartfelt mentor and really was the person that helped drive this forward for me. And so I just want to pay special homage to that, and that this research was funded by the Canadian Institutes of Health Research. So I'm less concerned about that acknowledgement, but it's there. And I also recognize the land acknowledgement that was done before, and that I am situated in Toronto on the traditional lands of many Indigenous nations. So this project was called First Nations Health Policy and Funding, Consequences for Those Living with HIV/AIDS, very broad. Lots of things came out of this. It was a 600-page dissertation. There were 5 overarching research questions, that the main one being, how does policy impact service delivery for people accessing care and services while living with HIV? But what I want to focus on here are really around the recommendations. And so what processes and actions can be taken by the federal or provincial government and or First Nations or non-First Nations communities and organizations to improve access and care for services. Can you see my presentation?
Hi, Sean, this is Tammy. It may be frozen. Or have you enlarged the PowerPoint itself?
Oh, hold on. Let's see what's going on here. I'm just talking to myself right now, aren't I?
Oh no, we've been hearing you, but the slides I don't think have been keeping up with you.
Okay, hold on. Let's see if I can get tech. How fun is this? Okay, share screen. PowerPoint. Okay, now it's going to work. Now you can see it.
Beautiful, beautiful. Thanks, Sean.
Okay. Fantastic. Sorry, everybody. So that's my acknowledgement, very text heavy. That's me. You can follow me at Twitter. I spent a lot of time finding that Twitter thing to put on there. So really the research question that I'm focusing on here is really around the recommendations that I asked my participants to focus on, and that was really around what can we do as a community, as like what can the government do, what can service organizations do to make your life better. And so I did a storytelling method with 29 First Nations, so very specific to First Nations, people who were living in Ontario and living with HIV, and asked them about their experiences of accessing care, problems with that, and really how we can go about changing that. And so the very specific demographic that I'm talking about here today are the straight men that I interviewed. And so they composed 11 of the 29 members, but overall had a very kind of straight leaning sample of 22 individuals. And so I think it's really important that to focus around the wellness of straight men because of the themes that came out around being ignored and not being heard within research and kind of broader implementation measures. And so what we found in relation to these straight male participants was that they stated that there were issues in accessing culturally based services and programs or services for both straight women as well as straight men. And so straight men did not see themselves reflected in services and programming that they were accessing, and that they said that this was substantially
que c'était moins probable
dedicated to men who had sex with men, or what many of them termed as, like gay men have lots of services, or there were lots of services dedicated towards women, but that there was this huge gap in them being able to access services. And then when they did have services, it was generally not culturally informed or Indigenous specific for them. And participants specifically said that as straight men, that they did not have access to information related to reproductive rights and risks, and that all of this information was substantially geared towards women, and that this was important because many of them were interested in becoming fathers. And so they felt that they had this huge knowledge gap around how they could become fathers and do so safely. And there were also concerns about a lack of information related to the criminalization of HIV within Canada and what their responsibilities were in having sex with women. And so this was a really big theme that came out over and over again of being that the legislation is changing and that there's a huge what they deemed to be a risk for them, and that this made them this made them concerned about disclosure and those types of issues. And so what are some of the links to wellness and well-being? So while treatment and support are widely available today, there are clear gaps in access for both Indigenous people in general, and more specifically for those who are living with HIV and AIDS. And that this was particularly apparent when looking at Indigenous straight men who seem to be virtually absent from both the research and the literature, but equally in service delivery and provision. And that they talked about this a lot, is that I don't see myself. And then equally as a researcher, when I was coming to this, I was like, yeah, I also from the other end see that there is this massive gap taking place, and that we lack a general understanding of what wellness means to and for straight Indigenous men, and that we tend to lump them into services and programming that's typically targeted towards Indigenous men who have sex with men, while ignoring their very specific needs and wants. And one of the things I want to focus on is this piece of art that came out of this research. And so Patrick Hunter, who's a two-spirited Indigenous person who's living here in Ontario, he read over all of the stories that came out of this. And I asked him to do a piece of art to represent this. And so what he made was this very large painting that kind of adored the dissertation. And so what you see here is a hand and a talking stick, which represented the stories of the 29 individuals. And that within that, you have the 7 feathers representing the 7 grandfather teachings, and that you have a smudge bowl with the traditional medicines that are cleansing the stories that are coming out, and that these stories are protected by the sweetgrass around it, but that sweetgrass also represents the HIV ribbon. So this is the symbolism. And so this was given back to our community partners and many of the participants that wanted to be connected with thereafter. And so what are some of this action and evaluation impacts? And so there were 29 recommendations that came out of this, and this article was just published in the International Journal of Indigenous Health through U of T, but I want to highlight two very specific recommendations. And these recommendations came out of participant-led interviews, but equally were brought back to the community organizations and with many of the participants. And so that's why they start with we. And so we call on the federal government to provide a funding envelope for services and programming, both culturally based and not, to meet the needs of straight Indigenous males living with HIV. HIV is affecting Indigenous straight males at higher rates than the general public, and we must recognize that services and programming have typically been directed towards men who have sex with men and women. And that equally, there was a call from many of these participants to both Indigenous and non-Indigenous HIV community organizations, especially as we move into the North, to ensure that they develop and implement programming and services that specifically cater to their needs and to their wants. So in closing, I just want to highlight that we ensure that straight males living with HIV and AIDS have access to specific services that meet their needs, including group counseling, information around injection drug use, issues of parenthood, and their responsibilities under the law. And they also talked a lot about the significant stigma and discrimination that they face while living with HIV. But that was a little bit different in that in community is that they were being labeled as gay, right? So they were facing, even though that they weren't. And so some of them said that they faced additional violence and threats because of that. And so it was this really interesting piece that came out around how they have to navigate this world for them that they thought was different from others. And that we need to increase the voice and understanding of Indigenous straight men who are at risk of and living with HIV. But that the key takeaway I really want to focus on here that I think was threaded through the other presentation is that we cannot address the issues of wellness and HIV without also addressing the underlying issues of colonization, including poverty, a lack of education, the lack of adequate housing, a lack of clean drinking water, addressing suicide issues, and the continued trauma that all of these men and women and two-spirited people in the study talked about. And so this is why wellness within the context of Indigenous people is so complex, because there are so many other factors impacting wellness. So thank you all.
Thank you, Sean, very much.